using a local wastewater surveillance program. The second way the CDC supports these programs is through analyzing the data. So these programs upload the data to a secure portal. The only people who have access to that portal, it's a couple hundred people who work in health departments across the US. I don't have access to it. And those people can log in and look at trends and quintiles and all sorts of things that the CDC, runs in terms of analytics. The CDC also sets the strategic direction for these programs. These programs can decide how they want to set up wastewater surveillance, but the CDC will support them in saying, hey, we have figured out how to run these assays, these analytical methods. We'll share these methods with you. This is where we're headed. So that's really the other way they support them. Right now, you can look at news data online in two ways. The first, they still publish their COVID data on COVID Data Tracker. So that's this link at the bottom. And if you were to go there right now, you would see that there are about 1,500 little dots that are participating in news. Again, these are from local programs. Like all these grayed out dots in Missouri just means that there aren't recent data. Those come from the state of Missouri run program. But North Dakota doesn't have a program, for example. So these two dots up there, they're participating in the commercial testing contract. But this is where all the data come together. And you can download these data, it's a publicly available data set. They do protect the privacy of the site that's participating, and they will not publish data from sites that have fewer than 3,000 people in that sewer shed. So something to keep in mind. The second way you can get data is for Mpox virus data. So CDC has a separate dashboard for that. There's about 500 sites where they're looking for Mpox virus still, and they're going to keep looking for it for a few more months and then maybe decide that it's not worth it anymore. But those are available at a different site, and that link is below. All the blue dots, by the way, mean that they're testing for Mpox. They have recent data, but they have not detected any Mpox virus at all at that site during that period of testing, which is really good news. Okay, the third thing to know is that this whole method of collecting data, it generates information that public health departments can use for action. And that's really because of these, the top two bullets here. Wastewater surveillance captures all infections, whether you go to your healthcare provider or not to get tested, it captures you if you're infected. And as a result, it gives you community level aggregated information, which is really helpful for health departments. And they tend to use it to complement other public health surveillance data. In many cases, depending on the disease that's being tracked in wastewater, depending on the testing sort of setup infrastructure, clinical testing setup for that disease, the wastewater can actually give you a leading indicator. It can give you a heads up of where community transmission is headed. For COVID, it can tell you when variants show up well before clinical samples can. And here are just some examples of how the data have been used by health departments to validate other public health surveillance data, to inform resource allocation. So these resources can be testing, vaccines, contact tracing, to increase public awareness. That's through messaging that local health departments send out or dashboards. The data have also been used to inform clinical decisions. So how to, should we defer elective surgeries? Should we open new hospital units? Should we, be prescribing specific therapies? And less commonly, the wastewater data have been used to help inform policies. And these are really ordered in from rank order from most commonly used use of the wastewater data to least common use. And here are just some examples of dashboards. Again, these are publicly available data that the individual local programs put out, whether, like I said, that's the state of Missouri, I already brought that one up, the city of Boston, which is where I live, and New York State, right? Those are just lots of examples of how the data are shared. Okay, and then last but not least, the fourth thing I want you to take away is that wastewater surveillance is useful for so much more than COVID. So again, I love the idea that the pandemic was a dress rehearsal for wastewater surveillance, right? We learned so much. Each disease is going to be different, but we have figured out how to set up these programs, how to support these programs, how to share data, how to do it in a way that is ethical and protects community privacy. So now we can kind of look to the future and think about certainly using the news to, if there were to be another pandemic like this one, imagine if we had this national system in place, we could have figured out very early on where COVID was, where it wasn't, and kind of made more informed policy decisions as a result. But we can also use it to track sort of ongoing endemic health concerns. I already talked about polio. Polio is not something that hopefully we'll have to use it for on an ongoing basis. We are using wastewater surveillance right now in the US to look for polio virus in New York State, in suburban Chicago, suburban Detroit, and I believe there are also plans to look at it in suburban Philadelphia. Missouri looked at it in all of their sites, didn't find it, thankfully. So it's very limited in how it's being used in the US. You already heard me talk about Mpox. That's a very clear application of this. It's also starting to be used for flu and many other things. So I'm just going to jump over that. So the question then is, what is the CDC plan? What are their plans for their kind of direction of where they want news to head? What else do they want it to be used for? It will always be available to be used for things like polio, Mpox, or sort of emerging diseases that just we don't even have, aren't even on our radar yet, right? But CDC is also going to add a whole bunch of core targets to their news panel. So what this means is they're helping develop the assays for this. They're rolling them out to all the programs, the laboratories that are running the samples for all the different local programs. And they will be able to collect these data, share them back with the public on dashboards. That's what it means sort of to roll out these core targets. These core targets, these are the ones that they're planning to include by the end of 2023. So by the end of this year, if all goes according to plan, but probably it will be into 2024, you'll be able to go to the CDC wastewater surveillance website and you'll see a dashboard that has information for all of these pathogens at all the sites. So what are these pathogens? So SARS-CoV-2 will continue to be included, influenza A and B, respiratory syncytial virus, adenovirus 4041, Shiga toxin producing E. coli, norovirus, Candida auris, and Mpox will be included for at least through the end of this year. In addition, they're going to also be looking for specific antibiotic resistance genes, carbaminopases, extended spectrum beta-lactamases, colistin resistance genes, and vancomycin resistance genes. And you may have seen in the news that colistin resistance genes were detected in Los Angeles County wastewater between 2020 and 2022. And then in addition, CDC will include normalization and process controls. So that's where we're headed. Again, the four things are, it's not a new tool. It's been used for COVID in many places. It generates actionable data, and it's useful for so much more than COVID. And then I just want to leave you my contact information. If you have any questions, please don't hesitate to email me. And with that, I'll turn it over to you, Dr. Susan.
Good afternoon, everyone. This is Dr. Susan Salashore, the Program Director for Ithaca College Physician Assistant Program. I'm excited to be here with you. Hopefully, you are ready to see what we're going to be doing with the help of Lewis in your region and with your help. We can't do this without you. Hopefully, you're seeing my screen. You should be seeing a mural that's in the building downtown. That's the background I have. We are part of the Ithaca College campus that's on South Hill in Ithaca, New York, but we have a downtown instructional site where our PA learners get to really do the work they want to do. And I put this picture here to let you know what we do, because I think it resonates a lot with Dr. Rosales and what he was saying and what Lewis was saying. Our program is very much focused on diversity, inclusion, equity, and social justice. The work we do has to be more than just seeing the patient in the office as physician assistants, as healthcare providers across any practice we have. I put this picture here while everyone was talking because I thought it was important. This is an event that happened this afternoon from 12 to 3 p.m. at one of our local organizations. The PA profession has a program called Project Access, and Project Access job is to take the concept of a physician assistant, and really healthcare professions is what I talk to mostly about. I talk about not just PAs, but do you want to go into nursing? Do you want to become a physician? Do you want to be a healthcare administration? But specific to us, Project Access is where PAs go out into their community and talk about the work of being a PA, the passion of being a PA. For instance, I've been a PA for 29 years. I've practiced in 12 specialties. My love is geriatrics, but I've also fallen in love with mental health and adolescent medicine because of a 13-year-old, and I'm just trying to help to support her during the endemic times of COVID. So I put this picture here because Lewis, and I think Dr. Rosales was talking a little bit about this, about what we can bring if you would like us to bring that. Yes. This is an example of what we can bring, Project Access. We want to make sure we recruit from rural areas, underrepresented minorities in medicine, BIPOC, so making sure we recruit people who look like the population they're taking care of. So there's a comfort in sharing some of these social determinants of health that are components that impact our health, but don't get talked about necessarily when you're seeing me in the provider office. So this model is really to create a place that we can start this work and let the work define itself by what you tell us you need. So in Dr. Rosales' case, I'd say, yes, we want the young people to come and visit us when we're at Lewis House, because we want to say, what do you want to do? And even if it's not PA and it's not MD, we can provide guidance. I also put this picture here so you can see this young man. We took a picture with him. The woman on the other side of me is Dr. Melissa Dundale. She is a physician for our K through 12 school here in Tompkins County. And her and I have partnered with this organization. This organization is called Village. It's in the different schools. They work with schools, they work with community partners to support students K through 12 with whatever they need and their families. So transportation, food, mental health support, educational support, whatever these students need, they provided for them. And this young man, from this experience he had with our learners, says he is thinking about becoming a PA. So one of the students, we call our students learners, gave him their coat and their stethoscope so he could have a picture. So this is an example of something we can bring with us when we come to serve you in whatever capacity you deem appropriate. I always have to show you this slide to say we're accredited and we're in provincial status. This other slide is to really tell you about who we are. We believe that we must serve the communities we live in, the communities we work in, and the communities we care about. And that may not just be where we live or where we go to school. So this is really critical. We recruit learners from across the country. We have learners from California, from Arizona. We have them from New York City, from Florida. So we have them across the spectrum from the Midwest. But the key here is we want to make sure our learners go back to the communities from which they came from and serve them, and then recruit other learners that look like them to serve those communities. We do use the equity framework. There is no diversity and inclusion without equity. We know there's things that impact institutional racism, structural racism that impact everything we do. So we have this lens when we think about how we deliver care. How are we going to provide what every patient needs at the place they need it, not just the same thing for every patient that comes in because they don't have the same needs. I thought it was important, as Dr. Rosales was talking, that we include this slide. I won't go into it, but more to show you, we have values. You can find these on our website, but we are focused on wellness, the equity work, good stewardship, bringing your authentic self and meeting our patients where they are. All of our learners have their pronouns attached to their names, again, to create this sense of authentic self and to make sure we're inclusive in everything we do. So really important that you understand this is who we are. The other piece is to say, in our classroom, when I have information sessions with our admissions coordinator, one of the things I tell people who are thinking about coming to Ithaca College PA program is, if you don't want to have conversation about your biases that impact the care you deliver, we're probably not the program for you, because we have to address our biases. So really important as we think about any model we bring, to really understand that providers must address their biases to give patients the best care. We are intentional about this. We have education around this. We have workshops around this. and we make ourselves accountable. Our learners lead a justice, equity, diversity, and inclusion committee within our program. And in fact, the leader of the group this year is from California.